All right, guys, you are all welcome to this to today's class. Um, Today's class is focused on OET reading part A, and I'm going to teach you the strategies, how you are going to um deal with this OET part A and be able to scale through successfully because this part A is the major part of that reading if you really want to pass OET, if you really want to pass reading subtest of your exam. Okay, so it's going to be a practical class. We are going to use a prototype of reading part A to show you how you can effectively go through that reading part A and pass very well. Once again, you are all welcome to this class. All right,
Thank you.
yeah. So before we proceed, we should know the basics about reading part A. Number one thing you should know about this reading part A is that you have a total number of 20 questions to answer. And you know, in OET, your total score is over 42. You have 42 questions in total for reading part A, B, and C. And out of these 42 questions, you have 20 questions, almost half of the questions in your part A. Okay, meaning if you can get those 20 questions, you've already gotten 20 out of 42. And the good thing is you don't even need 42 to pass. What you just need is you don't need 42 to pass. What you just need to pass is just 30. So if you get, let's say you get 42, you get 20, and from B and C, you are able to get 10. That will give you, you were able to get 10 out of 22, meaning you failed 12 questions. That means you failed 12 questions and and you're able to still get 350. Yeah. So that's one thing that you should know. You can mute your video if you don't, because if you don't want your face to be seen anyway, because this is recorded. Now, number of questions 20, and for these 20 questions, you will have 15 minutes to answer these questions. Now, this is quite challenging for some students because 15 minutes to answer 20 questions and you have 4 texts to read. So it's really not easy doing that. So that's why we are having this class to see how we can deal with it. Another thing you should know is that this another thing you should also know Another thing you should also notice this, that this paper is your first paper in reading. That's paper number 1 in your reading. Okay, that's paper number 1 in your reading. And after that 15 minutes, because they are very strict, immediately is 15 minutes, they will take that paper away from you. So you don't have time to do anything. And immediately it says stop. If you are still holding your pen or you are still trying to write anything, you can implicate yourself, and that's a serious offense. So you really don't need to write anything, immediately ask you to stop. Otherwise, your exam will be cancelled. Another thing you should also know is that in this reading, you have 4 texts labeled text A, text B, text C, and text C, and text D. So there are actually 4 texts you are going to read under part A that very day in order to answer those 20 questions. Okay, now, how are these questions arranged? There are actually 3 question types. First set of questions, usually from number 1 to 6 or number 1 to 7 or number 1 to 8, depending on how they arranged it. Those questions are usually the matching kind of questions. In this case, you are matching the text to the passage or the paragraph that you think that text is coming out from. We'll practicalize all these things. We'll see these things in detail just shortly. Then another form of text is the short text. In the short answers is another form of the answer, the short answers. When we mean the short answers, in this type of questions, you are just allowed to write a word or phrases. when asked. Then the last part of the questions will now be filling the gap. Okay, filling the gap. In filling the gap, a statement will be made and a word or a phrase is missing. What you are going to do is to fill that part. Okay, so that is it. So let's now go into practicals now. But before we do that, if you have any question, you can raise your hand first, or you can put it in chat box and I'll answer your question. Do you understand? Please don't unmute your mic in order not to disturb others. If you have any question, what you will do is to quickly raise your hand, and when I got a chance, I'll give you the opportunity to ask any question that you want to ask. Okay, so in summary, to understanding this reading part A, you have 20 questions to answer within 15 minutes, and this is one paper. And the text, you actually have 4 texts, text A, B, C, and D. Although this text is just tailored on one topic, it's not as if you have different topics. You are just discussing one topic. Let's say the topic is on diabetes. You are talking about diabetes. If it's on hypertension, you are talking about hypertension. They are not different texts per se. It's actually one topic, but it's grouped into 4 different texts. Then, you have 3 question types in reading part A. You have the matching type, you have the short answer type, and you have the filling the gaps part. I will show you how you can tackle all these 3 types. Okay. So now let's look at this reading text here. Okay. Let's look at this reading text here. If you look at this reading text, you will see it has text A, it has text B. This is how you are going to see it on that day. It has text C, and it also has text D. Yeah, these are the 4 parts of this reading part A. And now you now have your questions. The first set of questions, in this case, you have question number 1 to 7. Question number 1 to 7, they are the matching type. Yeah, in this case, they ask a question and they will ask you to match it. Are you seeing that answer in part A, text B, text C, or text D? You should be able to know which text that question is coming from. Then from question number 8 to 15, in this scenario, this is what we call the short answer. They will ask you a question. You're supposed to answer in a word, or you can answer it in a... It's either you answer in a word. It's either you answer it in a word. Okay, let me just admit some persons are trying to enter. Okay, it's either you answer it in a word, yeah, or you use phrases. Sometimes it can be combination of these phrases or words can be combination of plain words and numbers, depending on the type of text that you are giving. Okay. That's to question number 18 and question number 15. Then from question number 16 now, here you are filling in the gap in this type of question. A sentence, a statement will be made and you are asked to fill in the gaps. Okay. Now, I ask everyone to download the text. I don't know if we've been able to do that, to download the text. I ask everyone to download the text, and I don't know if you've downloaded the text, just write yes in the chat box to make things easier for us. Okay, now let's look at this text. On the exam day, this text will be given to you. How do you approach your text on the exam day? Okay, good. Some of you have already done that. Okay, that's fine. Well done, Gabriel, Carr, and Lillian. It's okay. Okay. It's all right. Okay, Faith still not able to download it. It's okay. Just follow the one here. It's just that you might not be able to follow with the any exercise that we are doing. All right, let me see if I can. Okay, if I can reduce this size, it's just that if I reduce it a bit, it may affect the clarity. Okay, if you look at this text now, you have text A, you have text B, you have text C, and you have text D. On that exam day, this is how the texts they will appear on that day. Although this is not the prototype, this is not like the difficulty of this text that I've used, because I'm the one that just made up this one just to like mimic what you have on the exam day. So the number of words for the example is a little bit more than this one here that you have. And again, the difficulty too on the exam day, it's also a little bit more than this one. But what is important here is for you to like get the skill. That's what is important here. All right. So on that day, you have text A, text B, text C, and then text D. What you do on that day immediately is given to you, because immediately is given to you and they ask you to start. The time will start going. Do you understand? And if you waste your time unnecessarily, you will just waste your chances of passing that exam. So what you do is not to start to read everything here in that text. What you do first is to try to, first of all, try to scan, try to know, what you do is try to scan, try to scan through. When I mean scan through, what you're trying to do at that initial point is for each text, let's say in text A, what is the idea in text A? And most time for every text, where you usually get the idea is in the topic sentence. And the topic sentence of most texts usually is the first sentence, or it's combination of the first or second sentence. Or sometimes you can find it in the middle, but most of the time it's at the beginning of the sentence. You have the topic sentence that tells you what that paragraph is talking about. By me reading the first sentence, it will like tell you what that paragraph is all about. Then that's what you quickly do. You can use a minute to do that. You don't waste your time. Quickly read through the topic sentences of each of the text. Now, if possible, on that exam day, if possible, you can try to like summarize it at the side of that text, because it's something that you will learn, and by the time you've learned it, you'll be faster in doing it. For example, let's see if anybody will be able to tell me what the topic sentence, what the idea in this first text is. What you just do, I will just give you 1 minute to do that. Let me see if you guys can actually try it. Use 1 minute to read text A, text B, text C, and text D in 1 or 2 words or a sentence, but not a sentence, just 1 or 2 words. Tell me what text A is all about, what text B is all about, what text C is all about, and what text D is all about. I will give you 1 minute to just do that. And how you should do that is to read just the first sentences. Yeah, read the first sentences of each of these texts, and try to see if you will be able to identify what this text, the whole text, will be talking about. Because you don't need to read everything on that day. Your 1 minute starts now. As you are reading each of it, and you are getting it, just be writing the text A. If text A is talking about investigation, just say investigation, text A. This text B, this text D. That's what you will just do, just to know each of the text, what is it talking about. Okay, don't write sentences for me. Text A, you tell me, you can place your answers in the chat box as you are getting each of the texts. Maths. That's really very beautiful. That's really very beautiful. Answers are already coming in. Okay, your 1 minute now is up. If you still have your answer, you can still send it in. Okay, let's see the answers that are coming in. Charity said text A is talking about definition and signs and symptoms. That's correct. Mary said text A is talking about introduction or definition. That's correct. Let's just say definition. Let's not say introduction. That's definition. And text B is talking about the causes. That's correct. Text C, it said diagnosis. Well, diagnosis, that's also correct if you think it that way, but I need a better word for that. Why text D is management, that's correct. Faith said that text A is definition and text B is cause, that's correct. Sunday said text A is definition, text B is causes, text C is diagnosis, text D is management. I'll prefer another word for that diagnosis. Charity said B causes, C diagnosis, and text D management. Okay. Now, very good. I'll prefer what Mary said, investigations. Do you get? I'll prefer that investigation for text C. Do you get? So this is what you quickly do to know what each of the text is, what's the idea in each of the text. Because the next thing you are now going to be doing is by the time you read a question, you will now try as much as possible. By the time you read a question, you try as much as possible to know which text is that will the answer of that question likely come. And you quickly go back to that text and skim and scan through to see if you will see the answer. Okay, so we've already agreed that our text A, they said in the first sentence, they say a Baker cyst is usually known as a popliteal cyst and is not regarded as a true cyst. This condition is a fluid-filled swelling that develops at the back of the knee and usually gets inflamed. So here is kind of talking about is defining this. If you read further through, which you will not have that time in the exam, is talking the further down is it will not defining it with the signs and symptoms. You don't read everything, you just read the first sentence and just scan through. It will give you an idea what the text is talking about. Now, the text B said the commonest cause of this cyst is an injury or a blow. So you see the main word there, the key word there is the cause. Commonest is the cause now. So here they are talking about the cause. If you also read through, you also see these factors and all that. So text B is telling us about the cause. Now, if you go to text C, the diagnosis of a Baker cyst can be made clinically. However, investigations are. Text C is talking about diagnosis, but measured on how to go about it, which is investigating it. Now, if you go to text D, in text D, they say the management of a Baker cyst is dependent on whether the condition is symptomatic or asymptomatic. And if you read through, they are not telling you all the type of treatment and management. So you can say you're talking about the treatment or how this thing can be controlled. So that's how you just note it out and by the side of each of the text, so that by the time you are going through the question, you will easily know where to go look for your answer. Now, having this at the back of our mind, let's see if anyone can guess where we'll go for the answer. Let's start from question number 1. Medical conditions leading to Baker cyst. The question from this question, they say, for each question 1 to 7, decide which text, A, B, C, or D, the information comes from. You may use any letter more than once. So here, 1 to 7 is the matching kind of question. Okay, you should be able to know where that text is coming from. So medical conditions leading to Baker cysts. Medical condition leading to Baker cyst. What is the key word here? Is the medical condition. And what will help you to get the answer is leading. What do we mean by leading? Okay, let me see where do you take that question? Okay, someone said B, Sunday said B, Charity said A. Okay, I want to do something now. Now, Charity, why do you think is A? Mary said B, Lillian said B. Charity, why do you think is A? Medical conditions leading to Baker cyst. You said initially that text A is defining or saying the signs and symptoms, while text B is talking about the causes. If text B is talking about the causes, and the question is saying medical condition leading to Baker's cyst, so it's like asking you medical condition causing Baker's cyst. Do you understand? So you should be able to know how to paraphrase and all, because you're not going to just see the answers blown away for you to just get the answers as cheap as that. So you've already said that text B is saying the cause, and the first question is saying medical condition leading to Baker's cyst. It means medical condition causing Baker's cyst. So in that case, if you go to text B, that's where you will see the answer. And when you've suspected where your answer is will be coming from, don't just go and pick the answer. Still confirm. Do you understand? Still confirm. Do you get? So you come back to B. Let me confirm if I'm correct. The commonest cause of this cyst is an injury or a blow to the knee during sports such as soccer, rugby, karate, etc. Some chronic medical condition can be a precipitating factors. For instance, age-related wears and tears associated with osteoarthritis, immune system attacking the joints of the rheumatoid arthritis, and buildup of waste product in the joints. Okay. Now, in this place, they are talking about what in this place? They are talking about the medical condition that can lead to this Baker's cyst. So B will be the answer in this case. So if you suspect it, don't just pick it immediately, but first of all, read through. But let's see, because I'll still have some comments to make at the end. Aspirating the cyst to relieve symptoms. Aspirating the cyst to relieve symptoms. Now you ask yourself, this question said aspirating the cyst to relieve symptoms. In another way, what do you think this question is asking you? Your text A said definition, text B said causes, C investigation, and D treatment. And here they are saying aspirating the cyst to relieve symptoms. Technically, what you're trying to do, you guys got it. A lot of you are saying D. That's correct. You are trying to treat this patient by this. So that means you are going straight to D to double check. Then question number 3 said, another name this cyst can be called. Another name this cyst can be called. Now, this might be a little bit tricky for you because, okay, maybe said A, that's correct anyway, but this can be very tricky for you. This is also where you can try to, as much as possible, to use exclusion factor. If they say another name this cyst can be called, definitely, this type of is not really related to the treatment. It's not like you are investigating. It's not like it's the cause, so to say. So it might go more like a definition. Do you get? But you still need to go back to that text A to confirm it if you can see where this cyst was called another name. So you scroll back to text A. If you go back to text A, you will definitely, I think that's it, even the first listing. A Baker's cyst is usually known as a popliteal cyst, and is usually known as a popliteal cyst. Okay, so you put A there. Now, in question number 4, how to determine if the level of complications. Not if the level of complication. How to determine the level of complications. Now, if they say how to determine the level of complications, what do you think as a clinician you are trying to do? You are trying to investigate, isn't it? Let's see what a lot of you see. So that means you are going to number C. That's correct, because text C is talking about investigation. 5 now say a metabolic product implicated in this condition. A metabolic product implicated in this condition. Now, you may have this type of difficult ones to do. So what you now ask yourself now, where will this answer likely to come? Someone might say, okay, maybe a metabolic product implicated in this condition. Someone might say, will it be in the causes? or will it be in the investigations? But investigation is less of it, so to say. But if you are kind of, okay, I think those who are answering CC, you are still talking about question number 4. Now we are in question number 5. In question number 5, what do you think the answer will be for question number 5? A metabolic product implicated in this condition. So you can suspect, will it be text A, will it be text C, or text B? Will it be text C or text B? So let's see, if you're not too sure in this case, because sometimes it can happen like that, that you might be suspecting that the question might be in any of the two texts. So what you can do is to go back and double check. Okay, so if you go to text C first to check, in text C, they were making diagnosis investigating. That's what they are trying to do, investigations that can be used on how to make diagnosis. But I think in text B, that's where they talk about a metabolic process that can cause, or if you say implicated, that means it can cause, it's associated with. Okay, because you say your text B is talking about the cause or the risk factors. Yeah. So a metabolic product product implicated is like you are discussing the risk factors. Yeah. So let's go again. Question number 6. In question number 6, a description of the cyst. This will be very easy for you to answer because you've already said question number A is talking about definition, isn't it? So they could now say a description of the cyst. Definitely is A, but you still need to go back to that A to double check. Definitely the answer is A. And then number 7, I say ameliorating the symptoms. Ameliorating is like making the symptoms better. So which of the texts will be talking about making the symptoms better? In that case, you're already treating the symptoms or managing the symptoms. So definitely it will be question number 7. Yeah, it will be text D. That's where you will get the answer. All of you are all correct, and that's correct. So that's how you deal with these matching questions. Yeah, that's how you deal with these matching questions. Now, let's now go a little bit. Okay, before we go to question number 8 to 15, if you have any question, you can raise your hand or ask your question. If you have any question, please ask. All right, no questions. Okay. All right, we'll continue from where we stopped. Yeah. We'll continue from where we stopped. Now, if you look at question number 8 to 15, in question number 8 to 15, what are you trying to do in question number 8 to 15? You are just using words or phrases in question number 8 to 15. Now, the same thing now applies because it's very important that 1 minute this thing that you do at that initial point. It's very important to do that 1 minute mastering, to familiarize yourself with those texts, to know A, what is it saying, B, what is it saying, D, what is it saying, C, what is it saying. Now, if we come to question number 8 now, okay, somebody want to ask a question. Uzamaka, what's your question, please? Uzamaka, you're raising your hand, or is it by mistake? All right, that's fine. Let's continue. So if you come to this question again, question number 8 says, what type of investigation is needed to rule out fractures? Now, where do you think this question will be? Will it be in text A that is talking about definition and signs and symptoms? Will it be in question number B that is talking about the causes? Will it be in C that is talking about the diagnosis or in the investigations? Or will it be in D? Definitely is going to be in C. Okay, what type of investigation is needed to rule out fracture? So you don't need to start from the beginning looking for your question. You just go straight to that text. Now, when you now get to this text, it's not as if you are reading anything. Do you get? The key word there now is fractures. What you quickly do, you scan through. Where can I do fracture? You just scan through, and see where you will get fractures. Now, this is where fracture is. Do you get? So this is where fracture is. What am I going to do? I'm going to read around this fracture. He said an X-ray of the knee joint can help to rule out any fractures, ligament tears, and fluid in the joints. Do you get? If I'm not still very convinced, let's say it was not very clear, I can still read a little bit further just to be sure that the answer I'm choosing is correct. So in this case now, what will be your answer? I'm seeing X-ray in the answer in the this thing. What type of investigation is needed to rule out fracture? The answer is X-ray. Now, it's better to say an X-ray. Do you understand? So an X-ray is needed to rule out that X-ray is what is needed in this case. So question number 9, let's make this a little bit bigger because it's getting. If we now come to question number 9, yeah. Okay, X-ray, that's correct. In cases where the knee joint is damaged, what kind of intervention will be needed? Now, the first thing is to know, where am I going? Which text am I going? So from this question, which text do you think you are going? Faith said D, and I agree. Because here they said intervention that will be needed. Intervention means like treatment that will be needed. So, and my text number D is telling me treatment. Then the next thing now is, what is now the key words that will help me to get the answer that I'm looking for? Okay, what is the key word? And the key word here would be what? Would be a damaged knee joint. A damaged knee joint. So what you're going to do now is to go to the text and look for, where will I see a damaged knee joint? Do you get? So we come here now to read, to scan through, not to read. You just quickly scan through to see if you can see anywhere you just see any knee or anything. You just kind of pause. Do you understand? So here they said significant damage around the knee joint. So let's read around this area now. If any medical condition is the trigger, it is very important that the condition is well managed to make the Becker cyst to go away. In some cases, surgery may also be needed to repair any significant damage around the knee joint or drain the cyst. So the answer here will now be surgery. Do you get? A surgery might be needed to do that. Okay? Surgery might be needed to do that. So the answer will be surgery. Okay. So surgery is what is needed. So let's go to the next question now. The next question said, in what scenario, what can happen to the cyst? In what scenario, in worst scenario, what can happen to the cyst? Where do you think this answer may be coming from? Well, in this kind of question now, you know, in your A is describing both the signs and symptoms. In B is talking about the causes. In D is talking about the investigation, and D is talking about the treatments. So among definition, signs and symptoms, because the fact is that in OET, about 2 or 3 questions in that part A will give you a little bit tough time. Let's assume that this is giving you a little bit tough time to decide where this question will be coming from. You might just skip it and leave it and move to the next one. Okay, but because we are just teaching, let's answer it one after the other. So we are all saying in A. So if you think it's A, you first of all go to confirm it in text A. In text A, you now read through. Yeah, they say in what scenario we can use that, look for where they talk about wars or where things are getting not getting better or something like that. These are the words you'll be looking for. So they say from studies, a few cases may be asymptomatic, while the worst scenarios can present with a ruptured cyst. Can present with a ruptured cyst. So what will now be the answer? What do you think that will be the answer? I'm waiting for your answers. All right, I'm getting ruptured. So let's see. In what scenario, what can happen? How can you answer that question? In what scenario, what can happen? Yeah, is that how they say? That's okay. Where are we? In cases. Okay, that's question number 10. In what scenario, what can happen to the cyst? Your reply now will now be, it will rupture. Do you understand? It will rupture. That should be the reply or the response, because they say use a word or a phrase. So you answer thing in an appropriate way. Just saying rupture, they can still give you that mark. But sometimes it's better to answer things in a way that it will look grammatically correct. Although it doesn't really affect this part. The part that it affects more is the last part, where you'll be filling in the gap. If you're answering anything and it's not grammatically correct, you're already filling that answer. So the answer is it will rupture, or the cyst will rupture. That's what I'm writing as the answer here. So if the 11 now said, if the condition does not affect the patient in any way, what treatment is required? They just say what. So in this case, it's just be one word or two, depending on the name of treatment. So here, where are you getting the answer? The answer will be coming in from D, isn't it? The answer will be coming from text D. And what do you think will be your keywords now? They are now saying if the condition does not affect the patient. In another way, if it is asymptomatic, do you get? So good. Lillian said no treatment. So what treatment is required? Your answer will be no treatment. That will be your answer. That's what is written in that in text D. Let's look at that text D. In text D, they said the management of a Baker cyst is dependent on whether the condition is symptomatic or asymptomatic. No treatment is required if the swelling is not painful or affecting the patient in any way. Otherwise, simple painkillers like paracetamol and ibuprofen can be prescribed to relieve pain and swelling. So you only prescribe paracetamol and ibuprofen if there are symptoms. Otherwise, no treatment. So your answer is no treatment. Somebody say no TMT. You don't write like that in the exam. That will be a fail. So it should be no treatment. All right. The next question will now be question number 12. In question number 12, in which medical condition does the immune system attack the joint? Where do you think this answer might be coming? Where do you think we can get this answer from? In which medical condition does the immune system attack the joints? Is it in A, that is talking about the description, signs, and symptoms? Will it be in B, where we are talking about the causes? In D, where we're talking about the diagnosis or investigation? And finally, in D, where we talk about the treatment. So I think it will better be in B, where we're talking about the causes. So in which medical condition does the immune system attack the joint? If you go back to text B, where we are talking about the causes and the complications of this, the medical condition that is associated with this, they said immune system attacking the joint in rheumatoid arthritis. So in this case, our answer becomes rheumatoid arthritis will be our answer. Now, question number 13 says, what kind of medications can be used to control the pain and swelling? What kind of medications can be used to control the pain and swelling? This will definitely be coming from D, that is talking about the treatment. So there you look for where your keyword now will be pain and swelling. You will look for where it is under that talking about treatment, and then look for what kind of medication that can be used. So let's see what your answers will be. Very good. Now, in this case, they are asking what kind of medications can be used. If you just say paracetamol and ibuprofen, that's not correct, so to say, because they mentioned paracetamol and ibuprofen as an example. There are other medications too that can be used, but the name or the group where all these medications fall under is simple painkillers. Do you understand? Simple painkillers is the correct answer here. Simple painkillers will be the correct answer. If you say paracetamol and ibuprofen, they just said simple painkillers such as, or you say like, they are giving example, paracetamol and ibuprofen. So if you just say paracetamol and ibuprofen, that's not the correct answer. The correct answer is simple painkillers. That's what you use to treat it, of which paracetamol and ibuprofen are examples. All right. In question number 13, do you think a trauma to the back of the knee can cause, or let's say, can lead to this condition? Do you think a trauma to the back of the knee can lead to this condition? They are just looking for yes or no, or true or false, anyone you want to. So the answer is yes. Where did you see that answer? If they say something can lead, it means can cause. So it will be under B, where they are talking, the text is talking about the causes. So if we go back to our text B, now in our text B, that's where it can't be sure, because they don't blow things out for you just like that. They will know if you actually understand English. They said trauma this time around. Now they said the commonest cause of this cyst is an injury or a blow to the knee. If you don't know that a blow or an injury is a kind of a form of a trauma, that means you might be looking for trauma everywhere in this text B. You will not find it, and you will not think the answer is not there. So you must demonstrate that you actually understand English for you to pass this, to pass the reading. Do you get it? Because the answers are not just blown like that. That's the ability to paraphrase, to understand vocabularies will help you to answer to get your answers too. So the answer is is true, or you say yes. So let's say I think question number 15, which will be the last under this group of questions. What can be wrapped around the swelling? What can be wrapped around the swelling? Okay. Although this question does not give you an idea or does not really lead you where that question will be. If they had said what can be wrapped around the swelling to make it better, that will give you an idea where you will be going. Because of you need to make it better, you now be saying, okay, most likely it will be the treatment. So in this case, you might decide, okay, will it be under the treatment they are wrapping something? Will it be under the defining it? Maybe there are some things that wrap around it. So you can go through text A and text D to know if your answer is correct. So, but the answer is actually in text D, where they talked about the treatment using, where they conservatively talk about managing it, isn't it? Okay. Where they say a knee support or an ice pack wrapped in a tea towel and placed around the swelling and the joint works very effectively. Works very effectively. So an ice pack can be wrapped around the swelling. Okay, so we've talked about how you match questions. We've talked about how you use words or phrases to answer your questions. Now, the next one, which is very tricky, and you can even fail easily, even when you think you've gotten the answer, will now be from question number 16 to 20. Here, we are filling in the gap. One tricky thing about this particular one is that whenever you are filling in the gap, your sentence must be correct. If you fill in your gap and your sentence is not grammatically correct, you will fail it. Whether that answer you've put in is a part of the answer or more than part of the answer, making that grammar not to be correct, it will lead you to a fail. So if you are putting any answer in there and you read the sentence must be correct. Now, let's look at this question. Blood tests, especially DASH, are crucial when reviewing a patient with a Baker's cyst. Now, where do you think this question will be coming from? Where do you think you will get your answer? That's the first thing you will ask yourself. Where you can get your answer, they say when reviewing a patient with a Baker's cyst. If you don't know, reviewing means like assessing, investigating a patient. You might not know where you'll be getting your answer. So in getting this answer, because we are investigating this patient, that means we are going to text number C. So if we come to text number C now, the diagnosis of Baker's cyst can be made clinically. However, the investigation are commonly carried out to support diagnosis and rule out the... No, they talk about blood test, isn't it? So we now go to blood test. If you go to where you just look for blood test, now here they said some routine bloods, including inflammatory markers. For them to say routine bloods, of which inflammatory marker is part of routine bloods, yeah? And they now said including inflammatory marker. It means that inflammatory marker is special. Do you get? So, and your question is now asking you what to fill in that gaps to, and a lot of you already answering inflammatory markers, inflammatory markers, inflammatory markers. Now let's go back to that question and see if inflammatory markers will fill in that space and then the sentence will still be correct. Blood test, especially, this is blood test. Blood tests, especially inflammatory markers, are crucial when reviewing a patient with a Baker's cyst. So putting inflammatory markers here is very correct. But note that this R, so to say, is not for the inflammatory markers. is actually for this test. That's where you are having A here. In case in your text, they wrote an inflammatory marker. If they wrote an inflammatory marker, what you are going to still write here will be blood test, especially an inflammatory marker, are, because this R is for this blood test. Now let's go to question number 17. A few cases of Baker's cyst may be dash. A few cases of Baker's cyst may be dash. Where do you think this question might be coming from? It's difficult to say, isn't it? So this is also, now you look at this question, it's looking very difficult. Number one, you don't even know which text you can. How will you describe where this text will be, where this particular answer will be coming from? It's difficult. You can skip it, move to another one immediately. If you cannot identify it, move to another one you can easily identify, get your answers before coming to the ones that are more difficult. Because both the difficult one and simple ones, all of them, they just have one score for each correct answer. If a question is difficult, does not make it to have 2 scores. And your goal is not to, if you can get 500 over 500, that's fine. But remember, your goal is to get at least 30 out of that 42 questions so that you can score 50. Sorry, so that you can score 350. Now, let me see what we are asked. Okay, they said asymptomatic, and we are going in A. Okay, a few cases of Baker's cyst may be asymptomatic. Let's see if we are correct. Let's go. Somebody said that we are getting the answer in A. I don't even know where this answer will be coming from, to be honest, because the text is not giving a clue, and you can have 2 or 3 questions like that will give you tough time on that very day. So you come. Then I say from studies, a few cases may be asymptomatic. This is where they just lifted it. So that few cases is like the key word you use to find your answer. So the answer is actually coming from what? From text A. Yeah? Your answer is coming from text A. Okay. So let's see. A Baker's cyst, question number 18. A Baker's cyst is described as a swelling, as a dash swelling developing at the back of the knee. I think there is a mistake with this. Okay. Now, if you have a question like this, before I conclude there is a mistake, I don't think if there is a mistake. If you have a question like this, because to also get your answer, it's also very difficult to know what form of thing you are adding. If they say a dash swelling, it might be that something is describing this swelling. So let me see. I think this should be in the definition because they say described. So we can go to the text that talk about the definition. Yeah, and see. Good. So let me see what you guys answered. Yeah, fluid field, that's correct. So a Baker's cyst is described as a fluid field swelling. That's what is going to be the answer there. Even me that even developed the text, and I was thinking, is this wrong or not? So that means it's an adjective, a fluid describing the kind of swelling. That should be here. Now, a Baker's cyst is described as they've already written A for you here, so it should be fluid swelling. Now, if in your answer, you now go to your answer and write a fluid field swelling, they will mark you wrong. That's not correct. If you write a fluid field swelling, because if you put a fluid swelling here, that means if you put a fluid field in this, if you use it to fill in this gap here, your sentence will now read, a Baker's cyst is described as a fluid. So it means you cannot have 2 articles at the same time in front of this thing. So be very careful what you are putting down as your answer, because sometimes you just go to OET and I say, I blasted, I know what I've written. Why did they give me 330? Why did they give me 320? I will challenge. When the question is wrong, it's wrong. When it is right, it's right. There is no two ways about it, especially in reading and in listening. Most of these questions are objective, and it's difficult to make mistakes marking those questions. So sometimes requesting for a remark in those questions is kind of a waste of time. So be careful what you are writing down as your answers, okay? Because if you make that mistake of writing, because they've already written an article, let us say they didn't put this article here and say a Baker's cyst is described as dash swelling, and you now write fluid swelling developing at the back of the knee. That's also not correct, because that swelling is a singular noun. So, and it should go with an article. Do you understand? So it should a singular countable. You can count number of swellings that somebody has. So in this case, it should be a Baker's cyst is described. Then you now add a fluid-filled swelling. But if the article has been given, you don't need to repeat it again in writing down your answers. Now let's look at question number 19. The commonest cause is dash or a blow to the knee. Let me see how many of you that will get this one. The commonest that will get the correct answer without making any mistake. The commonest cause is dash or a blow to the knee. Lillian said an injury. Charity said an injury. That's correct. So in this case now, this will even give you a clue what this question will be, that will be here. So if they say a blow, because they are giving you an option, anything that will be here will also be a noun like this. So it should be an injury. That injury will have an article. If you say the commonest cause is injury or a blow to the knee, you will fail it. That's why you wrote injury. Injury is not the correct answer, and injury is the correct answer. If you write injuries, you will fail that text. No half mark. The commonest cause is not injuries, but an injury. So be very careful what you are writing down. Then finally, the buildup of uric acid in the joint is implicated in dash. What condition is it implicated? If anyone can get that, I think that should be in... where will this be now? That will be in D2, yeah? No, in B, where they talk about the causes and complications, isn't it? The buildup of uric acid in the joint is implicated in what? Can you state the condition? I'm waiting for your answers. The answer is rheumatoid arthritis, isn't it? Well, I think there is actually a mistake in that text anyway. I think, let me see if, because uric acid is actually in gout in medical distance, but let's see. I think I didn't finish up the text. Let's see. So immune system attacking the joint in rheumatoid arthritis and the buildup of waste product, uric acid in the joints of persons with gout. Yeah. So for those of you that said rheumatoid arthritis, because you didn't get the full information, I will say correct, but the correct answer is not actually that, because it's the immune system attacking the joint is in rheumatoid arthritis. They now put comma. And the buildup of waste product, uric acid, in the joints of persons with gout. So is gout now in this case that will be the answer. Sorry for that error in the text. Yeah. So this is how you answer your questions. This is how you answer your questions. Now, in terms of where do I start from? Some persons will say, okay, let me start from number 7. Some persons will say they want to start from the beginning. The fact and the truth is this. To me, I feel it's easier to start from question number 8 in this regard, because by the time you start from question number 8, but still you are still going to do that initial exercise of trying to get each text, what's the summary, what are they talking about, and then you now start from question number 8. If you start from question number 8 till you get down and answer everything till 20, you might not need to be going back to the text again to know where the answer will be coming from anymore. In less than 1 minute or 30 seconds, you will answer question number 1 to 7 without even looking at the text. But it's always very important to still reconfirm in your text. But some persons still find it very difficult from that question number 7, and they feel starting from question number 1 to 10, from 1 to 20 will be cool. If that's the best approach, the best thing is for you to get what works for you. Because I've been in this for the past 3 years. Some persons have come up with a lot of that's 8 to doesn't work for me. I don't finish if I start from there. But a lot of people will say, majority of people will say from 8 to 20 first before going to 1 to 8 works for them. Why some other persons will stay starting from question number 1 works better for them. So anyone that works for you, just practice the two and see the best and work with it, because you're supposed to answer this, to be honest, if you follow these skills, in 13 minutes. 15 minutes is too much for this exam. So 15 minutes is actually too much for this exam, okay? So if you have any questions now, you can ask your question, because this is where we may come to the end of this class, believing that a lot of you have gotten some things. Okay, Lillian, your hand is up. Go on and ask your question.
Yeah, thank you for the wonderful class. I have actually learned a lot. My question is regarding question number 15.
Yeah.
Yeah. Let me just give me 1 minute. Let me open the test. Number 15. What can be wrapped around the swelling? And that answer should be under, where did we even get it? Management.
Under treatment, yeah.
Under management. Okay. They said a knee support or an ice pack wrapped in a pea oil and placed around the swelling and joints works effectively. You said the answer is an ice pack.
Yeah.
But to me, I think they are giving two answers, because they said a knee support or an ice pack.
You are actually correct, to be honest. You are actually correct. This is a text I formed myself. Do you understand? It's not like a standardized text. Do you get? I actually developed all these things myself this afternoon, just to explain things. But you don't have that type of confusion in exam where two answers will. Okay. Where two answers will be this thing. So if you actually wrote support, if any of you actually mentioned support, I would have said correct. Do you understand?
Okay. All right. Thank you.
Okay. Any other question? All right, guys. This is where we come to the end of the class. I will also upload this on the YouTube channel if you want to have a recording. Okay.
Yeah, Thompson, what if he wrote the two answers?
Any support on an aspect. Okay, so they're actually saying for what can actually write the two. Yeah, in this case, that's a better idea, isn't it? But if you actually write one, because they didn't say the two, they say this or this. Do you get? So if you wrote, but you can't have this type of complication in the exam.
Okay. What can be wrapped around the swelling? Knee support or ice pack?
All right. This is where we come to the end of the class. Do have a great night, guys. Bye.
Bye. Thank you.
I have something.
Thank you.